Welcome to the GFY Podcast, a podcast by healthcare professionals providing insight on how to navigate your health so that you can go fix yourself. The GFY Podcast is hosted by Mike Bruno, a chiropractor and athletic trainer, and me, Michael Sant, an athletic trainer and certified strength conditioning specialist. Although we are healthcare providers, we are not your healthcare provider. We will discuss general health interventions in this podcast, but you should not take that as health advice that works in every situation. Before doing anything on your own or making any lifestyle changes, please consult with your own physician. This podcast and views from this podcast are separate from our full-time jobs and our own opinions. If you're enjoying the GFY podcast, please leave us a review on your listening platform and or subscribe to our podcast at YouTube. Links to our show can be found in the show notes on any platform that you are listening to. So today we're going to talk about what I would kind of say is, what are you looking for when you go see a healthcare provider and know if they're right for you, right? That's kind of what the list we talked about prior. Is that a good way to go about it?
Yeah, I would say so. And it is also a very good, if you memorize these four things or write them down, they will be a very good bullshit detector if you're with a bad one. Because I feel like finding someone who can, a lot of people will say the right things to get you in the door, but then once they're actually taking you through their process, putting their money where their mouth is and actually doing the thing is a different story.
Yeah. And so kind of the list that we're drawing from is actually from an article. It's a review article, highly established journal, British Journal of Sports Medicine. And what they actually did was review something called CPGs, Clinical Practice Guidelines. It's actually more of a physical therapy thing, so I don't even know if you would be familiar with them, but essentially,
what a bunch of losers.
Yeah,
I'm
losers.
Just kidding.
We like PTs kind of. But essentially what it is, those are big systematic reviews I put together for physical therapists for a specific injury. For low back pain, these are the recommendations that you should do treatment wise. So what this article did, what this group of researchers did, they went and looked at all the CPGs all the ones that pertain to low back pain and knee pain, essentially. And they took out of them what were the most consistent recommendations across the board for all of them. Okay. It's actually kind of funny because in the same breath, they also kind of go, some of these CPGs aren't actually very good, which is actually kind of funny reading it. But anyway, we're gonna go ahead and get started. So the first thing that you should do is that the care should be patient-centered, right? So patient-centered care means that, hey, if you as a patient are going to get treatment, it should be centered around you. You should have a little bit of a say of what is going to go on in your treatment. If, gone should be the days that you walk in and a doctor goes, all right, 5 minutes, I see XYZ, we're going to start you on this treatment plan. Or it's I think about anytime you walked in with a sore throat, I think about as a kid, used to walk in and it'd be almost no evaluation or no strep testing or anything like that. And they would be we're just going to put you on a Z-Pack and we'll go ahead and just see if that works. Right. I think hindsight's 2020 on that one and being oh, they're really just taking a shotgun and seeing if it'll work.
Yeah. The two things. One of my professors used to say, if you had an ear infection, and you went and got it treated by went to the doctor and got medicine, it'd be gone in a week. But if you waited and did nothing, it'd be gone in 7 days. So his point being where it's in healthcare, sometimes things are either redundant or unnecessary. And then when we say patient-centered care, I sit back and I'm what's the other option? Doctor-centered care. That part doesn't even make any sense to me. But there are a lot of, when you say for-profit organizations, right? Businesses are trying to make money. So the thought process is hey, a doctor will take you on even if you might not be the best fit for their practice, because it's not about you, it's about their bottom line. That's how I look at the
that would be the other, that would be the bad side. That's how it doesn't become patient-centered care anymore, is what you're saying.
Right. So in the chiropractic world, it's a little more obvious, I'll say, where it's people, there are some populations who are very there aren't a lot of solutions out there for people. So people with different types of like mental disabilities, different like diseases and stuff, like even if it's like internal diseases, and they're like their normal general care won't give them any answers. Their specialists don't have any like solid like, hey, this is what it is what we're gonna do. They're like, and because it's a rare disease, it's like, hey, we can't really do much for you besides like this is what we know. These are our best practices, but it's a lot of times it can't be concrete because then it would just be like blowing smoke up the client's butt, and those people get, they're looking for something to hold on to, like they're looking for hope and stuff. And then a chiropractor will be like, I can fix it with an adjustment, and those people are like, oh, cool,
Yeah.
like something, and that's wrong. That is just straight up wrong. So if anybody has been in a situation like that, I would say get your favorite pair of sneakers, tie them up tight, and run,
Yeah.
because that is not cool.
Yeah.
During COVID, I was like stuck in the house and I was getting like letters in the mail, like come get an adjustment. Meanwhile, nothing was open, like nothing was legally allowed to be open, and it was come get an adjustment to cure your COVID. And I was like,
Oh
this is
God.
why
Yeah.
our profession gets viewed as a joke, because there's those 10% of radical people who
Your
are just
profession.
making out, yeah, my profession, me, chiropractors, 5%, 10% are making outrageous claims.
Yeah.
Like treatment for Down syndrome, treatment for ear infections, treatment for cancer. And I'm like, dude, stay in your lane, please.
Yeah. And so like I think what we're saying there is like right patient centered, like us as clinicians need to have similar goals as to like what the patient is trying to achieve. And if it's not mixing, it's one of two things need to happen. One, which is probably more likely, you as a clinician need to like tamper the goals depending on what it is. Like, right, if it's kind of what you said, something serious or a lifelong disease of some sort, it's like,
Mhm.
hey, we can maybe make improvements in certain areas of your daily life, but like this is something that you're gonna have to create management strategies for, not something that will be quote unquote cured. And
Yeah,
like like if you have someone who's had multiple back surgeries and whatnot, it's like, hey, you're probably gonna have a little bit of back pain all the time. Like it's just
it's
managing it.
yeah, it's expectation management's the first go. Like I had a guy who came in, he had a stroke when he was 2. On the phone, he was like, "Hey, like you would never be able to tell by like looking at me, but like I have some like significant like weakness on my left side and everything." I was like, "Okay, like would love to meet you." It sounded like a good fit coming for a consultation, and like he was way more like handicapped than like I initially could tell on the phone. And I was like, dude, thank you so much for coming in here, but like I'm not the right fit to help you.
Yeah, and like
So
some us, we need to be able to do that for people. Like I do it all the time as an athletic trainer. Like a
yeah.
lot of my job, especially in the high school setting, is referring people to get them to the right person.
Oh, 100%. Because like if he was like super on board with what I was saying, it's like, could we get maybe some like muscle, like some tension relief and some symptomatic relief? Sure. But like those weren't his goals.
Yeah,
So
as a
it's like,
stroke patient, it becomes like more neuro based. Like you should
yeah,
be going to a PT who is like works with straight up stroke, like
when
stroke
yeah,
regularly.
1,000,000%. And there's not a lot of like there's not a lot of like protocols or anything like that in our world. So it's like, dude, like I don't like I feel comfortable doing this. I don't feel comfortable doing this. Right.
Mm.
You live somewhere in the middle. So like um I can help you do this, but this is not going to get you the goals that you want. So like you need someone who can do all of this, and that's just not me.
Yeah, you pretty much took my second point, which is great, which is like if you guys don't meld together, it's either hey, you need to be the bigger person as clinician and say, hey, I'm not the right person, kind of what you said there. And I'm
Yeah.
sure like maybe someone gets pissed off here or there. Oh my god, they wouldn't treat me, but it's like
I
that's
think
truly.
they
You
respect it a
think so?
lot more.
I think it
Better.
depends. So I'm gonna be perfectly honest. I think it depends on the setting and who they're seeing and what the like.
True.
Yeah, so like in our world, I think it's easier to go that way. But like, let's say it's like general like injury or general illnesses, and they
Yeah.
go, "Hey, I'm not the person anymore. You need to go up there." But this should be respect. But I could see
I
some
mean,
deal match
for
bets.
me in my world where it's like a lot of out of pocket services, and I'm
Yeah.
like, hey, don't waste your money or time. Like this isn't going to get you where you want. They're like, oh, cool. Like you
Yeah.
saved me money. You know what I mean? So it's a little more
I
well
mean,
received that
yeah.
way.
Because you could always be like, hey, we can give it a shot, but like no promises.
No, dude, I was
Take their
actually
money.
literally having this conversation the other day. Like, you can't make any guarantees no matter what,
No.
but the bar is so low with especially like musculoskeletal care. Like when I talk to other people, I'm like, okay, so you had back pain and you want to run a mile. Like, what was the plan? And they're like, I don't know. I just went in, I got my back cracked, and he like massaged it, and that's it. And I'm like, okay, did he like look at running form, or did he like give you strength exercise to support running form, or like did you have any like blah 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 blah? And they're like, no, not at all. And I'm like, well, even
Yeah,
someone with
normal.
like no medical background could be like, okay, before you run, you have to walk.
Yeah.
You know what I mean? Like,
Or just like, hey, we need to make a plan on how we're going to achieve goals.
let's
Like
just
that,
put
this
it
is,
on paper. Yeah,
yeah,
let's just put it on paper for starters. And like the whole point of a plan is to honestly change it. You know what I mean? Like a plan sounds nice, and then you run to your first roadblock, and like the goal's still the goal. Pivot, pivot, pivot,
yeah,
and you get there. But that's why I called my company Nav, right? Because it's a navigation system.
hmm
So you're driving the car, you're making all the major decisions on your health. But if you make a detour and you go this way, I'm like, let's get
yeah.
back to the point here, and helping you get to your destination a lot faster and safer.
It's funny you brought that up. I was just talking to my little sister yesterday because she had like no clue. And it's like where you're just laying out the plan. She just like, I don't know how much or how little I should be doing now. It's just like but I just want to be a generally healthy person. So I legitimately just helped her lay out like, because she was like, well, I want to do this group class and that group class. Is it enough? Is it not? So we just kind of like, all right, this is what you're going to do. You're going to do dance or yoga one day a week. You're going to do that group strength training class one day a week. You're going to do your own strength training one day a week. And then you can run 2 times a week, 30 minutes each. And then we'll kind of adjust as we go. And that's how she'll hit all of her all the recommended numbers in the research of like 150 minutes of activity and whatever it is. I was like, honestly, that's all you need to do. And you'll be in a good spot with that. And like, to be honest, if she did one less of those a week, she'd probably still be fine.
That's great.
Yeah.
What's our next one?
Yeah. Number 2, screen patients to identify those with a higher likelihood of serious pathology / red flag conditions. So this kind of goes off a little bit off on the previous one. Like, and the biggest things for us, like, what are red flags for us? And I'm trying to think, big one for me is like, I guess for low back, we'll go to like a sciatica example. If it's like numbness and tingling going down one leg all the way to like the bottom of the foot, and you could answer this better for me. My always general understanding was like, if it doesn't go past behind the knee, you're kind of like, meh, whatever. Like we'll do some treatment first. Like there's no real restrictions on treating it. If it actually goes all the way down the foot and has maybe like a dermatome pattern or myotome pattern, so like specific areas of your foot are numb compared to the other side, you're probably going to be like, let's get some imaging on this first, right? Or like, that's a red flag. Maybe we'll hold off on treatment.
Yeah. Basically what a red flag is to me is, hey, these are strikes in the I'm not going to treat you column. So if it's something that looks truly neurological, right, not going to treat you. If it's something internal, so it looks like bowel or bladder stuff, like things like that, heart, lung. So we went through a lot of diagnostic courses for all that stuff. I learned how to do a heart exam, and I learned how to do a lung exam, all that. But the whole point of that is to be like, I know what normal sounds like. This doesn't sound normal. Go see somebody. It's recognize and refer at the end of the day. And I think a lot of times chiros get caught when they're like, oh, I learned this, so like let me just adjust my way out of this problem. And it's not a good look at all.
It's funny because and like I deal with probably a little bit more with like acute injuries and whatnot. Like, what are my red flags for referral? And like, if they have obvious deformity. Like, oh, that doesn't look right. Yeah,
Yeah, dude, you
like
can't
we said
rehab
it.
a
No,
dislocated
yeah,
shoulder or
yeah,
broken bone.
exactly.
Like, yeah.
Another one, I had a kid get hit in the ribs, and like initially he saw me and like he was just dealing with pain, like it just hurts there, like kind of discomfort breathing. And to be honest, I've seen so many rib contusions. I was like, hey, I'm not worried about that. Now, let's say it becomes excruciating pain, or you start spitting up blood, like you should go to the ER.
Mm.
Didn't see the kid for a week. See him back. It's like, hey man, like where you been? He goes, oh, I started spitting up blood. And like, right, yes,
It's like, thanks for telling
go.
me.
Yeah, it ended up, yeah, kind of crazy. Didn't have a rib fracture, just had a lung contusion. Just a lung contusion
Dude, there was a kid I went to high school with, his lung collapsed. Like,
after a hit.
no, he was like
It's just like a random
I think he
pneumothorax.
was a singer or something. Like, it
Oh
just like
geez.
spontaneously, like, just,
Well, I don't know if you saw. Sorry, really sidetracking. T.J. Watt had during dry needling, his lung collapsed. Yeah,
that is one of my
had to get
biggest
surgery.
fears.
Yeah.
Yeah, jeez,
Oof.
craziness. Any Hooser, what's the next one?
3, assess psychosocial factors. And I think this is big because this should kind of be like, I think about when you're treating someone, you always go to a doctor, they have those intake forms. They probably don't get read very well there, but it's like that's why you kind of do you're probably better off doing an interview with someone and having some of those questions asked face to face to kind of assess their psychosocial, like how are they handling the pain? Is there stuff going on outside of their life that's going to be why their pain is getting better or worse or whatever's going on? So I think it's something that is still missed a lot of the time.
So I would say for a lot. So this is actually a personal experience. I went to the doctor, like my general yearly physical, and the there are questions in their intake forms that are meant for this purpose,
Mm-hmm.
and like just the way that they get asked could drastically change like the interpretation because it's not the same person asking and interpreting. So the medical assistant comes in and she's like, "Hey, are you like a smoker or a drug user?" I'm like, "No." She's like, or no, drug user, no. Are you a smoker? And I was like, no. She's like, so you've never smoked anything in your whole life? And I was like, I have like a cigar at a wedding every like
Yeah.
maybe 2 or 3 times a year or whatever. And she's like, oh, okay, blah blah blah. Get moved to the medical room. And the doctor's like, okay, so I see you're a smoker. When did you quit? And I was like, what?
Just
Wait
not
a
reading
second.
everything.
Wait a second. Yeah.
I got
And
a similar story for you once you finish up.
yeah, and I was like, that's crazy because like, I'll, defend myself or whatever you want to call it, like I'll like correct her and stuff. But like potentially if I sat there quietly and I was like didn't say anything, like that could completely change the whole doctor's entire line of thinking because if I now tell her like, hey, like I have like chest tightness and stuff, like her whole like diagnostic mentality is shifted towards like, hey, this kid's been smoking forever or however long, versus like, oh, it might be something completely unrelated. So like it changes the starting point and can drastically change the outcome. The question's well intended, but like the way that you ask it and the way that it gets interpreted is going to make all the difference.
Yeah. And so maybe not so much on this third bullet point of psychosocial, but I went to a primary care visit one time and I went through it. A couple things happened. One, it was like the nurse, they didn't ask me what my physical activity level was at all throughout the entire thing. And so which is like, really? And so the nurse is like, I'm a little concerned. Your heart rate is really low. And yeah, my heart rate's like in the low 40s because I
And
exercise.
you're going like this.
Yeah, I was like, yeah, don't worry about it. Like that's normal. And she's, all right, whatever. And so then
You said that.
I told her it was normal,
You're like,
and she's
don't worry, lady, you don't know what you're talking about. Don't
yeah,
worry
yeah.
about it.
I kind of start taking over appointments. Which then later on, like I'm talking with the doctor, and I was like, oh, okay, like all things are good. I said, yeah, all right, can I get a blood test? I want a complete metabolic panel just to like kind of see what's going on. She's like, all right, sure. And so get it. It comes back. My LDLs are actually a little bit high, and
Same, actually.
yeah, and so they get on the phone and they're like, all right, well, your LDLs are high, so you should probably just exercise more.
I had a client that told me the same thing. I was like,
and,
dude.
and so and we're not nutrition specialists at all, but I started looking into it, and because first on my triglycerides, which is like
Mhm.
the free floating fat masses, it was like 20. That number is like almost there's no fat flowing through my blood. So like
Mhm.
the LDL number doesn't make sense, and apparently when that number is so low, your LDLs will come out high. Um,
Mhm.
and I don't know it. I would have to research it more. But
Mhm.
you're telling a person who at the time was running 30 miles a week and lifting 5 days a week to exercise more. That mentally could have thrown me into a tailspin. Instead, I just said you don't know what you're talking about and moved on. But like
Right.
that goes back to like you're trying to you need to find like a provider. I'll be honest, I haven't gone, and this is bad. I haven't gone for a regular physical now in 3 or 4 years because that
Mhm.
experience pissed me off so much. So I really
Mhm.
do need to find someone that is like understanding of what my goals are through
Mhm.
life, essentially.
100%. There's and like the psychosocial factor, especially when it comes to pain, if people have been in chronic pain. So if we define that as over what, like 6 months to a year, like
Yeah,
some people have been dealing with stuff for decades. And I'm like, that's miserable. And like it changes your brain chemistry
yeah,
completely because you're like people will say like, oh, like I have pain, but like I got used to it. Like that's not normal. Like
no,
you like living with pain is not normal. So it's like, okay, well, what do you like? What do you want to? What do you want to do about it? And they're like, oh, I can just like live with it forever. It's like, okay, that's a choice, right? But I just want you to know it's not the only option. And they're like, well, I've tried everything before, so and their outlook is very pessimistic because to be fair, like they put in a lot of work and haven't gotten a lot of results. So it's a disappointing scenario. And usually that's because one of two things is that whatever they tried was focused on the wrong area, or it didn't if it was focused on the right thing, the timeline wasn't right. So it's like, hey, I did it for a day when you needed to do it for a month. You know what I
yeah.
mean?
And but even going off that, it's like the psychosocial aspect of like talking about like just having that conversation of like you're not supposed to be in pain based on like what your diagnosis is and all that. Like this
Yeah,
is something that we can for sure work on. And I think
100%.
then rewiring happens and they go, oh, there's some hope. Maybe I can actually get there. And like, part of it's you doing the eval and showing some stuff and getting them out of some pain for maybe an hour. Like that's kind of where it starts.
Yeah, 100%. And the conversation, like that whole like, hey, this like the reason all the other stuff didn't work before is like either wrong time or wrong place. And it's like, okay, you tried X, Y, and Z. You and me are going to do A, B, and C, and then we're going to reevaluate. We do A, B, and C, and they're like, wow, like I notice a significant change, right? That's a really good sign that we're on the right track. So now we have the wrong or the right place, right? Knowing that and knowing your history, we get to talk through a plan and come up with the right time. And those two things together have a infinitely higher success rate than the like the what's it say? What did I say? Spray and pray, where it's just
Yeah.
like
Yeah.
you're on YouTube, like let me do that
Yep.
one. Like
Yeah.
that just sets you up for confusion and frustration. Literally talking to a guy yesterday, he's like, dude, like I have this like sharp shoulder pain. I know I should be stretching mobility, like I know the things that I should be doing, but I go on YouTube and I just get like overwhelmed because there's so many different opinions. This guy's trash talking this guy who's trash talking that guy. Like I don't even know where to start.
Yep.
And I was like, well, that's a big reason why like guidance, the navigation system
Yep.
is super, super helpful because it shrinks that time,
Yeah.
right? It's like it takes you 6 months to figure out on YouTube. We can figure it out in 6 days.
Yeah, exactly. Um, I think that's good. So we're going to move on to our fourth and final point today. So the fourth point is that radiological imaging is discouraged. And there's a couple of reasons why maybe it's not. It's if you suspect a serious pathology, fractures, grade 3 ligament sprains, as in like stuff completely popped, things like that. Or there's been unsatisfactory response to conservative care. That's like for you, it'd be like you treated someone for like 5 months and there's no progression. You're gonna say, hey, you should probably get an X-ray. Hey, an MRI might actually like be beneficial in your case. Um,
Mm,
So it's really those two main points, and then 3, it's like it's likely to change management, which like, hey, you might actually have displaced fracture in your back. You might actually need surgery on it. Like that will change your management. That's how I'm going about it. But yeah, so radiological imaging is often discouraged. And I know you're big on this because like for low back pain, it's like the general recommendation is never get an x-ray. But also in the chiropractic world, it's using x-rays to convince people, hey, this is wrong with you, we'll fix it.
Already? Here we go. This is one of my favorite conversations. So with x-rays and MRIs, if it's, to your point, if it's going to change what we're going to do in the office, necessary. If we are worried about something scary, tumor, like big, scary stuff that we can't treat in office, imaging, necessary. Outside of that, it's not necessary. I tell people all the time because the common complaint is oh, I just want to see what's going on. It's like, okay, your health, your decision. Once you do see it, right? Let's go down that rabbit hole. Once you do see it, then what happens? It's like, oh, then like we can just like do what we've been doing, right? It feels like an unnecessary step a lot of the times. Usually it comes down to the psychosocial and like the trust and the knowing what it is something that's such a hard hurdle for a lot of people, because if you take 50-year-olds, right, 25 of them probably have some form of arthritis, disc bulge, or like significant findings on the MRI and have no pain. The other half probably has no findings on an MRI and they do have pain. So what you see on an image does not explain your pain usually, which is why this exists now. It's like, hey, it's probably going to cause you, like, people get imaging for clear answers, but it actually adds a layer of confusion because they're like, hey, I'm in pain, but my MRI is clean. Now I'm more confused. Or the flip, it's like, I thought I was fine, but I get this imaging and I have all this stuff wrong with me. It's like, now I'm scared. Not helpful in 90+% of conversations.
No, it's funny because obviously you're familiar with the low back stuff. In the shoulder, the general recommendation for like slap tears, so like tears in overhead athletes, like within their labrum, within their shoulder, is actually don't get imaging for 3 months, rehab it for 3 months, and then kind of reevaluate. There's also a really cool study in Major League Baseball where they just healthy baseball pitchers, no issues. They just took MRIs of all their throwing shoulders. Half of them had labrum tears. Like labrum tears that would be recommended to have surgery on most of the time. So
if I could say like to someone, like, it's like, you know, you want to have good bedside manner and like, but like the people who I've been working with for a while and like they get my sense of humor and they trust me and everything. If they ever like came to me and was like, I think I should get an MRI. I'm like, okay, why? Like, I just want to see what's going on. It's like, okay, let's say we see something, then what? And it's like they get like,
especially for
no
like
one
what you're
thinks that far.
For what you're dealing with, they're not going to magically all of a sudden get surgery. They might get a cortisone injection, and like that would be it.
Most people are working with me to avoid surgery in the first place.
Yeah.
So like if you go talk to a surgeon, like surgery is probably going to be a much more likely outcome than talking to me.
Yeah.
Like, you know what I mean? So you have to know who you're talking to. If you're going to a butcher, you're going to get a steak, you know? If you go to the your first point of contact, I forget what the exact study is. We'll have to look this up. If you go talk to a surgeon as your first point of contact, your chances of getting surgery for back pain is like 10x, right?
Yeah.
If you need it or not, right? Like, so there is so much like over prescription of surgery where people are getting surgery to correct pain that is not necessary.
And like that low back, that's pretty extreme, but like that happens all the time in the knee. Like I had someone go and they're like, yeah, we didn't really see much on the MRI, but we're just going to scope your knee anay.
Yeah, I didn't see much. Let's scope it. They're like, why are we getting imaging in the first place? It's like, let me just go in and just like suck some stuff up. Like, I don't know. That's crazy.
we can kind of wrap up on this too with all that with the imaging. So there's a study. It was in Finland. No clue how this study got approved, to be perfectly honest. But like it was with
I know which one you're talking
the
about.
shoulder pain and doing so. Like they had two groups. One, like they both had shoulder pain, and what you're supposed to do is a subacromial release. So you're supposed to go in, cut a ligament in the shoulder to relieve some space. Well, in half of them, they went in and did that. And the other half, they just went in, came back out, did nothing.
They just cut the skin, right?
And they had the same exact results. I want to say, it may have been a separate study. I don't know, the same study. They also had a study that just did conservative treatment the entire time. And I think they all just, over a year, they all did exactly the same thing. They all did the same exact result.
Yeah. Time is a very good healer. It's, if you get stuck in like a wheel, like of, hey, I need to stretch, or hey, I need to do whatever. Like, what do they say? They say, what's the Einstein thing? Like insanity is like doing the same thing over and over, different results.
Yep.
So, hey, I just need to stretch every day. It's like, hey, how long does stretching like feel good? 20 minutes, an hour afterwards. It's like, okay, so you can either like, that's a choice. Like you can do that every day, and like you have to like continuously do that every single day, because like that's going to be your results. Or you can go and like actually address like what's causing it to feel like it needs to be stretched in the first place, so that you don't have to go do this every day, right? Both are options. You pick.
Yeah. So sweet. No, I think that wraps this episode up, I think, pretty well. We'll get 6 to 7 more points next episode. Cliffhangers, a lot of stuff, unless you're into the research like I am and go find the article.
Probably not.
That's what we're here for, to shift through all of it so that you can go fix yourself.
Go fix yourself.